Yeah. Do I have to go live?
If you go live, then it will go live.
Okay. You ready?
Hello. I'm not sure how many people are seeing me right now or if anything is clear. If you can see and hear me well, please write in the comment section. Seems like we are live. Okay, so I'm just going to go on and introduce myself. I'm Dr. Muhammad Ibrahim Ivan. I am a trust doctor working in the NHS, soon to be starting IMT from August 2019. Today's session is based on the specialty training in the UK. Mainly, we have made this session, we arranged this session in order to serve as a Q&A, because we started this blog almost more than a year now, and we've been helping a lot of people. And I think the main focus of doctors who comes to the UK is obviously getting into some sort of training so that their career progresses further. And we have a lot of questions. We get a lot of questions from a lot of viewers and from the readers of our website, how the training is structured, because it is understandable, because a lot of people, a lot of doctors comes from different countries, and the training structure is different in different countries. So to understand how the UK training is structured and to go from there, it's the primary target that any doctor should have, like how to get into training as soon as possible, or how do I manage to get into training. So we have made one video, specialty training in the UK, a few days ago. It's in YouTube. It's in focus series, specialty training, and a lot of people said they really got helped by the video. So thank you for that. Just it will be a reiteration of that video again, almost, but this live session will include mainly the questions and answers. But in the background, I'll keep telling you about how the specialty training is structured in the UK, and as soon as I get a question, and we'll just start answering from there. So specialty training in the UK, in pen and paper, it's actually 3 phases. The first phase is foundation training. The second phase is the core level training, and the third is specialty training, which is ST, and the core training is CT, and the foundation training is FY1 years or FI years. So as I've foundation years is the internship for the UK and EEA graduates that wants to do here, which is run by United Kingdom Foundation Program Organization, shortly called UKFPO. Do I or do an IMG needs to get into foundation training? The thing is, you technically don't need to get into foundation training, because you already have full GMC registration if you're coming via plab pathway or the postgraduate qualification pathway. Once you get full registration, you are already have completed FY1 year technically. So for the FY2 year, you don't have to join an official training which is run by the UKFPO, because you can get the competency side, which is right now called Certificate of Readiness to Enter Specialty Training, which was previously called Alternative Competencies of Foundation Years or Alternative Foundation Competencies. That form needs to be signed before you can apply for any core level training. That includes GP training as well. So that form can be signed when you are in a non-training job as well. So you don't technically need to get into an FY2 training post to get that form signed. You can start as a non-training doctor under any of the trusts and speak to the trust and speak to your consultant that I have got full GMC registration and license to practice, but I don't have my foundation competencies signed. Can I in this job get my foundation competencies signed? the consultant might agree to you that at the minimum level you have to work under a consultant to get those competencies signed is 3 months. So technically you can get it signed when you start in the UK, or you can even get it signed from back home. How? You have to work at least 3 months under a consultant after you get full registration of your country. So you finished your internship. I'll give Bangladesh as an example, as I'm from Bangladesh myself. So say I finished my internship in Bangladesh and now I've got registered to be a registered doctor in Bangladesh. Then I started working in some clinic or some hospital, and I started working in a regular job in a hospital under a consultant. So if I work there for 3 months at least, and if I tell the consultant in Bangladesh that can you get my competencies signed, he can get those competencies signed. All the form fields needs to be filled, whether he's GMC registered. If not, then where is he registered? Obviously he will be registered in Bangladesh. Then where can I find his registration information? If you go to our post specialty training opportunities or even specialty training in UK, we have a link to the CREST form that needs to be signed. In that form we have it all explained there, who can sign and what's the position and everything. So initial target for applying into core level training is to get the CREST form signed. Some job may tell you that yes, some consultant may agree to you get it signed within 3 months or even 4 months. But if you're unfortunate, or if your hospital is not, willing to, they may say that you have to work a year or something. It all depends upon how you clarify this before getting into the job. You can ask this question in the interview that you get into, that yes, I'm getting into this FY2 level non-training job or CT1 level non-training job. How soon or around what time I can get my foundation competencies or CREST form signed? So that is the first target if you want to apply to any specialty training core level, which includes internal medicine training, includes GP training, and includes any other CT1 level or core level training. You have to get your foundation competencies signed. All right, so I can see some questions here. The first question that I'm going to answer is it compulsory to pass all the steps of MRCP during IMT? And is IMT equivalent to MD medicine of South Asian countries? It's a very good question, and it's a very obviously we learn by comparing the degrees. Yeah, I'm going to answer the first part. Compulsory to pass all the steps of MRCP. In curriculum of IMT or even previously CMT, it was mandatory to get the MRCP finished within your core medical training. The thing is, mandatory in a sense that if you don't finish your MRCP when you are in CMT or IMT, you can't apply for ST3 posts. So the thing is, your IMT will not stop. You will have to keep trying to pass the MRCP. If you can't finish MRCP all parts within the 3 years of IMT, you might have to take time or extra time to finish the MRCP and then be eligible to apply for further training, which will be specialty training. So your training is actually evaluated in structured, is called appraisal, but the training appraisal is called ARCP. So your ARCP will have a substandard or non-standard rating because you couldn't fulfill the MRCP. That might affect your specialty training application, but everybody manages to pass the MRCP paces after completion of CMT, which was 2 years even. But if they fail, sometimes they can ask for an extension, 6 months or so, to finish the training, to finish the exam and go to the training as well. Will it be equivalent to MD medicine of South Asian countries? No, it's completely different. MD is a master's degree, which is an academic degree which you get from the universities, but the training you're getting is from the deanery. So it's a postgraduate training, not a postgraduate degree. So you will be an MRCP after the IMT, hopefully, and if you get the fellowship after the specialty training in any of the specialties, maybe you'll get FRCP. That depends on which Royal College's fellowship you're looking forward to. But MD, you'll have to enroll yourself in an university and you have to go through the course. Some doctors, some UK graduates do the MD after their foundation years before they go into the CT. But I think for IMGs that route is possible if you come into a student visa first, finish your MD, and then get into training from tier 4 visa to a tier 2 visa. If you take that route, you can have an MD and then get into an IMT. But it's if you want to start your training as soon as possible, then you have to put off getting your MD later on, or maybe sign up for a distant learning MD course, which many of the universities in the UK offers. I hope you answered the questions. Then the next question, I'm getting a lot of questions, so I'll be quick to answer. GP consultant. How many years will it take to start GP consultant after GMC registration? And please explain from GMC registration to SHO, then how many years to start GP training? So you're saying GP consultant, but GP and a consultant are different terms in the practice in the NHS. A GP is head of the primary care, is a primary care physician, and a consultant or a specialist. Not all consultants are specialists, but most of the all specialists are consultants. But the thing is, a consultant is a secondary care head. I get it what you're saying, but the thing is, yeah, GP. So GP training consists of 3 years of training, and you can start the GP training as soon as you have the foundation competencies and you get into a training. So if you start as an SHO with already the foundation competencies signed from back home, you can apply in GP training as soon as possible. You just have to go through the recruitment process and pass your MSRA exam, go to the interviews of the GP training interviews, and then start GP training, which will take you 3 years. Within these 3 years, you'll have to complete the MRCGP and the all other workplace-based as a WPBS, and you'll be able to register as a GP after you get the CCT from the training deanery. So GP training takes 3 years, and you can start as soon as you get your CREST form signed, which is the certificate of readiness to enter specialty training, which is the foundation competencies, and then you can apply for GP training. And GP training is easier in a way. I would not say easier. I would say it's easy to get into because number one, there's a lot of GP training posts. Number two, an IMG can apply in round 1 of GP training and as well as round 2. So you just have to prepare yourself for the MSRA exam and also for the interviews and get it from there. The next question, if I had already did specialty training overseas, planning to do via plab way, how do I do the training here? So if you had already training overseas, it depends. Actually, none of the training will be counted towards your training years in the UK, unfortunately. So all of the training that you did will be counted towards experience. So that will show commitment to the specialty. So that might boost your application or scoring in the interview when you apply for a training here. So if you had completed the specialty training already in another country, which might be more than 3 or 4 years or more than that, so it would be better for you to look forward to getting into ST3 or ST4 of the specialties. So you have to get your core competencies of that specialty as well before you can apply for that. I'm going to give you an example, say cardiology. So you completed your specialist training of cardiology in your home country, but you want to be a cardiologist in the UK. So you have to go to the cardiology training in the UK, which starts from ST3 or 4 level, because right now IMT is for 3 years. So for a UK doctor to apply for a cardiology training, they have to finish their internal medicine training and then complete their MRCP, and only then they can apply for a cardiology training, which will go for at least 3 or 4 years. So if you have already completed cardiology training back home, you don't actually need to go through IMT again. You have to just start as an SHO or a registrar if they apply you as registrar, and complete your MRCP and get your core competencies signed following a portfolio that the IMT doctors follow, and then become eligible to apply for cardiology and do the training all over again, unfortunately. I get the next question. I hope I answered that question. If I have not answered any of the questions, or if you have got the answer, please comment on the comment section below the thank you for the answer or anything. If you have any further follow-up question, I will go through the questions again and try to answer the follow-up question as well. Assalamu alaikum wa alaikum assalam. If no internship done but OET and plab is done, can I still take non-training job with provisional license? Unfortunately, no. With GMC's provisional registration, you can only get into UKFPO's foundation training. Nothing, no trust will employ you as a doctor because they want you to have a full GMC registration with a license to practice. So you have to have completed some sort of internship somewhere which will be acceptable to GMC and convert your provisional registration to full registration, or wait until you get your internship done and then take the plab exams and then apply for full GMC registration. I think that's the better way for international medical graduates to complete the internship back at home. But the thing is, if you have not completed and you have graduated many years ago, I would still say start working in your country or complete internship, start working, amass at least 2 years of postgraduate experience, and then go to GMC for registration. They may consider to give you full GMC registration, but without an approved internship, which we have discussed extensively what is an acceptable pattern of internship in our post internship in UKFPO, without that, GMC will not give you full GMC registration with a license to practice, and without full GMC registration and a license to practice, you cannot work as an SHO in any of the hospital in the NHS. Then the next question, is it too difficult to get into ophthalmology, radiology training as an IMG? Yes, I would say it's too difficult, but I wouldn't say it's impossible. There's two different terms you have to understand. Yes, it's difficult. Why it's difficult? Because there are a lot of people wants to get into this training and there are less seat in this training. So it's difficult. But is it impossible? I wouldn't say it's impossible, because ophthalmology and radiology, if I'm not mistaken, both of them requires MSRA, and also they are I'm pretty sure they are run-through training, so that starts from ST1. So you have to apply at ST1 level, and ST1 level application, if you don't have the right to work, that you cannot apply in the initial round, you have to wait for the re-advert round, and the application post being so low, there may be nothing to apply in the re-advert rounds. So you have to find some ways to get into apply into the initial round. There are some ways that you can get the trainee, the deanery sponsored visa, like if you get into a WAST training or if you get into a standalone training, then you are actually funded by the deanery. So in the next application round, you can apply for ophthalmology ST1 in round 1, you can apply for radiology ST1 in round 1. So that increases your shot, so you can take that route. We have discussed this extensively in our specialty training opportunities, like how you can make yourself eligible to apply in round 1. But the thing is, given these competitive specialties, applying in round 1 doesn't mean that you'll get into it. It's competitive because it's competitive, but making yourself eligible to apply in round 1 obviously gives you an edge, at least some shot, other than not applying at all. The next question I go for to hello. I have just completed my MRCS Part A and B and going to register my GMC. Congratulations, that's a big thing. So can I go direct to CS1 specialty training? Unfortunately, no, because MRCS Part A and Part B, if you have already completed it, you are already overqualified to get into a core surgical training. And why would you want to go back? If you have completed MRCS, that means you have completed the exams that a core surgical trainee completes. So you just have to work as an SHO or as a registrar and get your core competencies for the CST1 signed and go towards applying for ST3 in general surgery or whichever ST3 you want, like maybe vascular surgery or ophthalmology. We have an extensive post also in our blog, which is called specialty training in surgical specialties. I think a lot of doctors got benefited from that post, because I actually wrote this post after speaking to one of our colleagues who I've worked in A&E with. I mean, he was a surgical SHO and he got into ST3 being an IMG. He worked as an SHO for 5 years and he got the ILR and he got eligible to apply in ST3 round 1. And this 5 years of SHO working in surgical career gave him a lot of opportunities to build up his CV. He did 13 audits, 2 quality improvement projects, and he gained all the publications and all the other to beef up his CV because he worked 5 years in a surgical SHO post. So he kept in contact with the consultants, how to get into these things like publications and research and everything. So he made his CV that way. He also passed his MRCS exam while in UK working as an SHO. And after 5 years, he got the ILR. So he became eligible to apply in round 1. And at the first instant, he applied for ST3 general surgery and he got into general surgery. So general surgery training. So hopefully in the next 5 years, I think, 5 years, he will be a consultant general surgeon. So that is the way you should go. If you have already completed MRCS, you have done a big thing. So you just have to start doing an SHO, or even if you can, like you're confident enough, to start a registered job somewhere in the NHS as a non-training grade and get all the important parts of your CV built up, like get publications, get research, get experience working in the NHS in a surgical job, and when you are eligible, then apply for round 1 in ST3. Surgical jobs have to have a long game, otherwise it's really less amount of posts and very competitive as well, which is understandable. So yeah, you have to take that route. Where have I gone? Okay, there's a lot of questions I can see. Sorry, I've just lost. I scrolled too quickly. MRCS. Okay, Abdikani. How to improve portfolio as an IMG? I'm sorry, I'm not being able to read the names. It's not that clear. How to improve portfolio as an IMG? We have discussed extensively in our IMT portfolio post. If you can have a read through it, it's mainly there are some sectors that you have to have something to speak about and have something to show for. The main important thing is some sort of teaching experience, some sort of leadership experience or leadership training, some training in teaching or even some teaching experience, doing some quality improvement projects or some clinical audits. These 3 are quite easy to do as an IMG, as an SHO, and this gives a boost in your portfolio as well. If you've already done a research, very good, that also adds to your CV. If you haven't, when you start working here, you can ask your consultant. If you work in a university hospital and there's a lot of research going on, then you can get yourself into a research. I wouldn't say it's easy, but it's doable if you work in a big hospital and there's research going on. If you work in a small hospital in the UK, then it's very easy to get into quality improvement projects, because obviously there is something which is not going right or not going to according to the standard. So it's easy to run an audit and it's easy to run a quality improvement project. We have I keep saying this, that we have a post, because we do. We have written everything extensively in our understanding audits and quality improvement projects. If you go through the post, you will understand how a clinical audit takes place, how to do a clinical audit, and how to structure a quality improvement project. I think I have a follow-up question somewhere. GP consultant salary versus internal medicine consultant salary. Differences. Yes, the thing is, GP salary versus a specialist salary varies, depends on how many years you've been working as a GP or how many years you've been working as a specialist. Initially, I cannot tell you the exact figures, but a GP and a consultant almost makes the same amount. But obviously, as they gain more experiences and they work, they take more responsibilities and their pay goes up. So obviously, when you start as a GP after 3 years of training, you will not start getting the salary of a consultant straight away. You'll have to work towards the surgery you will be working at, and you will earn gradually more, because a specialist have already been trained almost 8 years and a GP has been trained 3 years. So to get into a specialist surgery, probably you'll have to, a specialist salary, probably you'll have to work as a GP for at least 3 or 4 or more years. but it increases as the time goes along. And at the end of the day, GP and specialist almost earns the same. There is specialist may earn a bit more, but yeah, it depends on the responsibilities they take. How to get into trauma and orthopedic training after MRCS completion? I think I've already answered this question. You have to target towards getting into ST3 level of any of the surgical training. I know orthopedics and trauma probably is a run-through specialty, but their training also, the recruitment also takes place in ST3 level. So if you have already completed MRCS, you have to gain the core surgical competencies or the core competencies for the orthopedics doctor. There must be some sort of competencies formed for to getting into an ST3 of orthopedics and trauma. And you can get this from their recruitment site, the TNO recruitment site. If you Google it, obviously you'll be able to find it, which site runs the recruitment for the ST1 and ST3 of TNO. You have to be just eligible to apply for ST3. The primary eligible would be an MRCS, which I've already done, very good. The other eligibility criteria would be get the competencies signed. So you have to work towards getting that competencies signed to be eligible to apply for ST3 trauma and orthopedics, which may take you a long time to be eligible to, because maybe there will be no post available for you to apply for ST3 in trauma and orthopedics if you are not eligible to apply in round 1, because the shortage of posts in those specialties, and obviously tough competition. Next question, what is the path to get into radiology training in the UK? Is doing FRCR beneficial in the application of the training post? What about MRCP? Radiology training in the UK, as I've told you earlier, it starts as a run-through training. It starts at ST1 level. The same thing goes for them as well. Yes, FRCR would be definitely beneficial. It will be giving you a commitment to specialty, and also I'm pretty sure that you'll not have to start from ST1 level if you gain the competencies to start from somewhere else in the middle. It all depends on the competencies required for the specific level. And I'm talking about these competencies, I'm talking about this eligibility, how to actually find where and how much eligible I am. Let me just show you one page here. There we go. We have it's not our website, obviously, it's the specialty training in the UK. I think it's their official website. Here, if you go below, you can see all the specialties and all the levels have their person specification. Their person specification will tell you everything that you need to know, how much eligibility is required. Say medical ophthalmology ST3, probably you will give some neurology ST3, neurosurgery ST1, neurosurgery ST3. So all of them will have the requirements and eligibility, what needs to be getting into. For an example, I will show you one from core surgical training. So let's see that where exactly it says. See, it clearly says eligibility. It says about that you have to have the evidence of achievement of foundation competencies, which will be CREST, and that it's clearly says certificate of readiness to enter specialty training. Then say here it is, it's a very important one, all the specialties have this career progression, some sort of thing. It clearly says 18 months or less experience in surgery, not including foundation modules. So if you have worked in any surgical field more than 18 months following your internship, then you are not eligible to apply for career progression. This experience in surgery includes everything. Like if you have worked in ophthalmology, if you've worked in general surgery, even if you worked in a clinic or in a hospital, where you can write in your CV that I've worked here, will be count as an experience in that department. Yes, if you work in any emergency medicine, that will not be surgery. If you work in medicine department, that will not be surgery. So it's surgery and related fields. Okay. Let's go back to the questions again. Okay. How can an improved CV? I have answered that. How can an IMG improve his or her CV? I think I have answered that. Okay. It's all related to getting the leadership, teaching and training, quality improvement, research, publication, all of this. You have to get involved in things when you're working in the UK. Next question. After the medical training initiative, level ST3 post and the GMC registration in UK, can I enter specialty training and which level to start with, especially if not holding MRCP? If you're not completed MRCP while you're in MTI, then yes, I know it's a hypothetical question, but the thing is, most of the cases about MTI, people should be taking medical training initiative. Yeah, it's after the medical training initiative, you have to complete your MRCP during that time. If you have not completed, then you have to get into IMT. Like it's you have to start from the bottom again. Like if you have gotten into an MTI, that means that you have some sort of postgraduate degree. Otherwise, you wouldn't have gotten into an MTI. So if you have not completed MRCP during the MTI process, you can apply for training after the MTI process or while you are in the MTI. That's not a problem. You can apply for the training if you are competent otherwise. But if you are not holding MRCP, then you cannot apply for ST3 level ND training. So you have to have the MRCP completed. Otherwise, you'll have to go back to applying for IMT and then take it from there. Okay, so our next question is, I think, the higher the ratio of applicants to a particular specialty means more years we have to spend after completion of IMT to build our CV. Is that right? No, because after you complete IMT, when you're completing IMT, you are eligible to apply in round 1 because you are in a deanery sponsored visa. So even if the competition is high, say, I'm sure that dermatology, cardiology, these are pretty competitive specialty to get into. So if you apply in round 1 and you didn't, so you can also apply in round 2 and still you didn't, then possibly you'll have to take a trust gate job as a registrar because you have completed your IMT. Then you get off from the deanery sponsored visa. You get into a trust gate sponsored visa. So it makes your life a bit difficult because then for ST3 post, you can only apply in second rounds. You cannot apply in the initial round anymore because you get only one shot in applying in round 1, which is at the end of your IMT. So if you're really targeted towards a competitive specialty, then start from the year 1 of IMT to gain all the related and necessary, gather your portfolio that way so that you get into that specialty or you do well in the interview. And I think it's not that difficult if you have built a portfolio around that specialty so well during your internal medicine training. I was reading about gastroenterology training in the UK. I was confused regarding some dual training which most gastro people do. I think not gastro, I think a lot of medicine related doctors do the dual training in general medicine as well. Say a doctor who is doing the gastroenterology training, got into gastroenterology training, he or she also does the acute medicine part of it to get his competencies or her competencies signed for general medicine. So at the end of the day, any medicine specialty can get with dual CCT in general medicine or acute medicine and the training that they got into. So they can be gastroenterologists at the same time as general medicine consultant. They can be cardiologist at the same time as general medicine consultant. They can be renal consultant at the same time acute medicine consultant. It's all done when you are on your specialty training years. So you have to have a target towards the training director or the educational supervisor that I want to obtain this dual CCT. So I will take these responsibilities again. So I work with a gastroenterology registrar who, if he wanted to go into gastroenterology, he didn't have to take the on-calls to do the acute medicine stuff. But he does take the acute medicine stuff so that at the end of the day, he can get CCT in general medicine as well. So it works that way. It all depends on your specialty training. When you do the specialty training, you structure your training that way, sitting with your education supervisor and training program, I think it's called TPD, training program director. So you work your path that way. Also some specialty training can also get like out of the training stuff to get a lot of doctors do stroke that way. They do 1 year or 6 months of stroke, and they also get competencies being a stroke consultant at the same time, along with the consultancy they were doing. So an acute medicine consultant can be a stroke consultant as well. Let's go to the next question. You gave an example with cardiology, but if it's OBGYN, how would this work? So do GMC registration after plab and then? So same thing, OBGYN is a very competitive specialty to get into, and the whole OBGYN starts as an run through. So it starts as an ST1. Even though it starts as an ST1, as I've told earlier, sometimes the people drop out of the training, so they have some vacancies in ST3 as well as it goes along, but the vacancies are really small. We have an extensive blog post about specialty training in OBGYN. It extensively discusses about how to get into this. So the plan would be getting into a non-training job, getting the foundation competencies signed, making yourself eligible to apply at ST1 level of OBGYN if you are at that level. But if you have already completed some parts of MRCOG, either part 1 or both part 1 and part 2, then probably we'll look for getting into the core gynae competencies signed, doing an SHO job first, and apply for ST3 level or a higher level if there is vacancy, and get the training from there. I'm saying applying at that level. Sometimes applying at that level is not possible if you don't have the right to work, because there is the post available to apply in the re-advert rounds. So you have to take the long game. You have to wait for 5 years or so until you get ILR, and then apply in round 1 and take it from there. Or get into any of the training or dinner sponsored visa, make yourself eligible to apply in the initial round, and then take it from there. Some people get into GP training to switch to any other training, because GP training you can apply in round 1. So you get into GP training, you work as a GP, and not work as a GP, I mean you work in a GP training, which will be working in a hospital. And then when the training application opens, then a lot of people take this route to apply in radiology ST1. A lot of people uses acute medicine ST3 to apply into competitive ST3 specialties. I mean, if you want to waste a year, I mean, it's not wasting, I would say it's just that you don't want to wait for full 5 years and you want to take a chance. Because if you are in ST3 acute medicine and say you want to do ST3 surgery, or say any other ST3 that you want to do, you can try, and if you didn't get into, you can still continue to do ST3 acute medicine. It's not like that they are putting you out of the training. You're just applying for a training. If you get into it, then you have to tell that I'm not continuing this ST3 and I'll go into that ST3. And if you didn't get into, you just continue the one that you were in. Nowadays, we can complete even FRCS in home countries. If someone can complete FRCS back home, what is the pathway to become a consultant surgeon in UK? It's the same thing, I would say. If you can get the competencies signed, you can apply in this respective level. So if you have the core competencies signed, you can apply and get into the ST3 level. If you had completed FRCS, if you can prove to GMC that all the training you got back home is equivalent to the UK training, you can get a specialist registration as well. But that is called CESR, Certificate of Eligibility of Specialist Registration. So that's a task that you have to take. It's a difficult route to tread into, to be a specialist without having any training in the UK, because you have to prove to GMC that all the training you got in your country is equivalent to the training they get in this country in the UK. So GMC has extensive documentation regarding specialty-wise how and what to prove and what to present to GMC. I know an oncologist in the UK who got a specialist registration in oncology directly using his training from back home. He did it. So I'm not saying that it cannot be done, but I think it's too high up to start thinking about if you are at the like bottom portion of your career. But if you've already done your specialist completion registration, you're working as a specialist in other countries and you want to move to UK, then you may look into it. GMC also provides advice and also guidance for CSR application. If you go into GMC website and search for CESR or CEGPR, you can get more information there. Okay, next question. Thanks for your answer. Is it possible for me to get into FY1 as I have right to work in the UK and spouse? We say yes. Yes, it is possible because you will be eligible to, you have the right to work, so you have to apply for the FY1. But I would only advise to do that if you have not completed internship, because if you have completed internship, there is no reason for you to do an FY1, even in non-training year. I think it's Doctor, are jobs easily in the UK for IMG and how's the job security? This is not related to specialty training, but I'm still going to answer that. Jobs easily in the UK. I think the person tried to mean, is it easily available, the jobs? Yes, the jobs are available. We're trying to tell people as much as we can to show that yes, jobs are still available, but that doesn't mean that jobs will be handed to you like flyers or candies. I'm sorry that I'm sounding mean a bit, but the thing is you have to work towards it. Like you got your GMC registration and license to practice. That doesn't mean that everybody will give you a job. You have to present yourself that way. You have to put your application neatly. You have to sell yourself well. You have to do well in the interviews, and only that you'll get a job. More people are applying, so yes, the competition are getting a bit high, but that doesn't goes to say that there is no job. There are jobs, but as more people are applying, so you have to make your game up. You have to be competent enough to get that job which is available. Job security, yeah, I mean, yeah, if you get into a contract basis job, you're there for 1 year. If you get 3-year contract, you're there for 3 years. Like there will be no reason for you to for the trust to tell you that no, you just have to go. People are not let go of their job by that easily because NHS needs doctors a lot. Let's go to the next one. Can do MRChem in India and register as specialty registrar in UK? I'm not sure about MRChem these days. I have to refresh my memories in how the emergency medicine works. I think they're trying to abolish MRChem altogether, and they're trying to put FRChem primary and the secondary or the last exams. But if you have already done MRChem, I think on the basis of that you can get GMC registration. Provided that you have completed other special prerequisites like IELTS and OAT and everything. So with an MRChem, you can apply. You can apply to get a GMC registration without doing plab. And after you get GMC registration, if you get into a training, you get into a training. Otherwise, you'll have to work as a non-training job. I have passed MBBS back in 2013. Now in state government job, how can I go to UK and practice? So if you have completed MRCP or MRCS, then you have to take plab. If you have not completed any of the postgraduate which is qualified for GMC registration, you have to take plab, make yourself eligible to apply for GMC registration, get the GMC registration, get into the system, use your experience to get a non-training job, get into a non-training job, apply to training, and go from there. Next question is thank you for such broad answer. Okay. Next question again. One of my friend is currently doing his post-graduation in orthopedics in India. He will be completing it 2020. What should be his pathway to work as an orthopedic doctor? The same thing. I'm repeating the same thing again and again. If he has completed his postgraduate in orthopedics, that will not be counted towards his orthopedic training in the UK. He'll have to make he'll have to make himself eligible to get GMC registration first, either by doing MRCS or by doing plab. After the GMC registration, he would have to gain the competencies to get into a training. If he wants to get into ST1 again, then he'll have to gain the foundation competencies. If he wants to get into ST3 level, then he have to get the core competencies, and then the training in the UK will go on and go forth. The training back home will not be counted towards years of training in the UK. It's unfortunate, but that's how it is. Like, even a doctor from the US who has been trained there, they cannot just come to the UK and work as a specialist. The training in this country is very separate. Yes, they can. Yeah, I'm not saying they can't. Yes, they can, if they can prove via the CESR route. If they can prove that the postgraduate training that I got in the India is equivalent to the postgraduation training that people gets in UK, then they can. And there are ways, actually. CESR, please search this CESR thing in GMC's website to get more insight about how a already finished postgraduate postgraduate doctor can apply to become registered in the UK as a specialist. How competitive is anesthesiology? Does it have round 2? I think I will just show a page. This is our specialty training opportunities. If you're asking about how competitive a specialty is, all the answer is in here. You can go towards seeing all the training programs and how post and how many accepts is here, and this is where the competition ratios. The competition ratios doesn't mean that all of them got into it, just shows the application numbers. So that means that if it's low post and more application, it's a very competitive specialty. Almost everybody will get into the round 1, so there will be no round 2 for re-advert rounds. So that gives you an idea. See, in general practice ST1, you have 3,763 posts and 4,900 people applied. So that means there's a high chance that if you apply, probably you will get into. And we can see here, this medical ophthalmology ST3, there are only 3 posts available in, I think it's 2018 data. So only 4 people applied because they know, ST3 level, because a lot of people probably have already are in ST1. So let's move on to the next question. That's my face and the questions. Okay. Thank you. I got the answer for my first question. I'm not sure whether you had a second question. If you had a second question, please ask away. If you are an IMG who has British citizenship, can get into FY 1 year after clearing plab exams when you finish your bachelor's without doing internship? Yes, actually, yeah. If you have British citizenship, that means you have right to work. So if you have completed your bachelor's degree elsewhere, then you have to complete the plab exams, get the GMC registration provisional, and then apply for UKFPO. I'm finishing my postgrad this year, planning to work in the UK. Will I have to take up MRCS, or is there any other route? How good are the chances after MRCS? Yes, MRCS, I'm assuming that you are talking about surgical specialties. It's competitive. You have to take the long game again. If you have already completed post-graduation this year, then you have to take MRCS to go forward to get into an ST3 specialty in any of the surgical specialties. So you have to have completed MRCS before even you can apply for ST3. There is no other way in surgical route to apply further without an MRCS. So after an MRCS, you will be starting again at ST3 level, which will be the specialty training in the UK. Your post-graduation, unfortunately, will not be counted towards your training in the UK. Got the answer of my second question. Thank you. I am a physical medicine and rehabilitation specialist in my country. I have passed plab. Is there any way for me to enter dermatology or plastic surgery specialty? There's 2 different specialties: plastic surgery, surgical dermatology. Both of them are pretty competitive. I'm not saying there is no way, because I always say nothing is impossible in the UK, unlike US. It's possible, but you'll have to take a long route. If you don't have the right to apply in round 1 of the trainings. Then you'll have to gain the competencies, and you'll have to wait towards the improve your portfolio to work towards that training, because dermatology starts from ST3, so you have to have competencies of the medicine specialties, like which is the core medical competencies, which you obtain when you do IMT. You have to have that, and then only, and you have to also have to have MRCP, and then only you can apply into dermatology. But I'm not sure whether only those will be enough to get into dermatology, because it's the number of posts is really less. So you have to have your CV very, very good to get into those kind of competitive specialties. After plab, is it recommended to do non-training job as an SHO in cardiology if I want to become a cardiologist, or at the level of I2, it doesn't matter whichever department? It actually is better if you work in rotationals, but one rotation includes cardiology, so that when you finish your IMT also should have a cardiology rotation if you want to apply in a cardiology, but it's nothing mandatory. But if you do, then you can do something in cardiology, like you have the competencies, or you have the clinical skills to work in cardiology. So if you have a rotation in cardiology, aim towards gaining those skills in cardiology, which will help you to get into an ST3 cardiology in the long run. But it's not mandatory to be in a specialty to get into an ST3 later on. You just have to get your competencies, which is overall. Some private universities promise good career in medicine there without plab. Your opinion? Nobody can promise you career without GMC registration. So if you're getting GMC registration some other way, then you have a good career. Like some other way includes MRCP, or some other way includes MTI. So universities does not provide registration. Universities does not provide postgraduate training. Universities only provide postgraduate degrees or diplomas like MD, MSc, or MCH, or whichever, MS, or any diploma or anything of that sort. Universities cannot get you into a training without you having GMC registration with a license to practice first. And then thank you so much, sir, for you don't have to call me sir. We are all colleagues. It's sir is a very it comes off as a very respected person. We are all in the same way. We are the same level. We are going towards the same direction, and we're all colleagues. You don't have to tell me sir. It's all right. Thank you, sir, for telling me this. Thank you so much, sir. Again, okay. You don't have to call me sir. You're such a blessing. Thank you. It means a lot. We are doing this to help as many doctors as possible, and I think it's almost getting 1 hour now. I think we'll have to wrap this up as quickly as possible. I see a lot of people did follow-up questions, which is actually good for them. But those who are seeing it as a YouTube video, you can always ask a question in the YouTube comment. Maybe you have missed the live for some reason, but you can always comment in the video below, and we're there to answer your questions again. The last 3 questions I'm going to answer. Okay, I can see more questions popping up. Okay, during internship, may I appear at plab 1 exam if I have done my OD? Yes, I have done that myself. I have appeared in plab 1 during my internship, and I have appeared in plab 2 after I completed my internship and got my registration back home. How can one exempt from RLMT without being an UK citizen only on the basis of work experience? You can be exempt from RLMT if you already have that deanery's visa. So and also Tier 4 if you have a student visa. If you have a student visa, you already have work experience. You are already in that. If you are already in that deanery sponsored visa, I'm saying this because if you are already in a standalone program, or if you are already in a training program, you can apply. You are exempt from RLMT. You can apply in round 1 of that training program of that deanery. Say you are working for Health Education of England. You're working in a training of Health Education of England in FY2 or WAST. So when any application opens for Health Education of England, you can apply in the round 1. You're exempt from RLMT. As a starting job, how would you compare SHO job in the NHS versus an RMO job in a private hospital? Can we get the competency signed by an RMO jobs? It's unlikely. I have not taken that route, but I have heard from people The thing is, RMO jobs are pretty unsupervised jobs. So if it is unsupervised, why do you think a consultant will sign you off in your competencies? Because consultants are more likely to sign you off when they see you work, when you're supervised. When you see that, oh, this doctor has seen this patient, this doctor has done this procedure, and I can see him every day at work, he is diligent to his work. Most of the RMO jobs, you'll be, it's a resident medical officer, isn't it? So you'll be staying in a private hospital, or you'll be doing the work in a private hospital, and the consultant will come, see his patients, and go home. He will be not actually observing you because there is no structure for them to observe you, because you're hired privately to be a resident medical officer, and the house officers or the SHOs in NHS hospitals are more have a structured supervision of their work. So it's definitely advisable to work in NHS hospital initially. You can work as an RMO if you are taking a time off, or if you are in between your training and you already have an ILR and everything. That's a different conversation. But I would advise to start in the NHS any day of the week. I'm doing my MD Pediatrics in India. Please tell me how I need to enter the UK system. If you're doing an MD Pediatrics, very good. That will show your commitment to the specialty pediatrics. You'll have to I'm not sure whether the camera has died. We'll just wait for the batteries to change, and I'll keep answering the question. The question was MD Pediatrics. Yes, the MD Pediatrics will give you the commitment to the specialty. You'll have to complete plab or MRCP CH to get into the specialty. First, to get into the GMC registration first. After the GMC registration, then you have to apply for pediatric jobs or pediatric training. So yeah, let's go to the questions again. The questions would be, thank you very much for the detailed answer. No problem at all. If someone get into residency program in BD, assume neurosurgery phase A, will it boost one's portfolio? Let's go back to my face again. Yeah, hello. Yeah. Okay, so yes, actually, if you have work experience in neurosurgery, it will boost your portfolio. You have to get the necessary papers that you have worked there, maybe get some letter of recommendations and stuff from there, and apply later on. Like anything, work experience helps in your application, but it will not count towards your training. So you have to get the competency signed, and you have to get into the training application. Neurosurgery is a very competitive specialty, You have to have a very good portfolio, and also you have to be exempt from RLMT to apply in round 1. So if you are going towards that, I would not tell you that you can't, but I would advise you that it will take you a long time. Maybe during that time, your friends will be starting in medicine, will be a consultant for 2-3 years, and you'll still be a registrar. I've told previously in one of the videos, that can happen, and that happens in surgical specialties, but it's not impossible. You can work in neurosurgery department in the UK as well, but maybe not a consultant. What is the application for SCCS emergency? When is application? You can look it up in the SCCS website. They have a website for recruitment, and they will have a table when and how the apply and when the dates are open. I cannot remember at the top of my head, but it's obviously in the internet. All success to you guys. Thank you for your efforts. Thank you. After doing 2 years of post-graduation DMRD and working as radiologist for 7 years post-graduation, do I get any exemption for plab or FRCS 1, or how to go into radiology training? The thing is, if you have work experience and you get into a training, you can negotiate the years with your training program directive, but I'm not quite sure how it works. But to be put bluntly, postgraduate training from outside UK is not counted towards training inside UK, because it's quite difficult to prove that your training in your country is equal to training in the UK, just because of that. If you have find some ways, or if you can prove to GMC, or if you can prove to the deanery that the training I got in back home is equal to the training in UK in all aspects and purposes, then possibly you'll get an exemption. Please show some light how to get into dermatology. Dermatology starts from ST3. You have to complete your IMT, then apply for dermatology, but you'll have to have a good portfolio because dermatology posts are so less. That's the thing. Can IMGs apply for round 1 SCCS emergency if you are exempt from RLMT only? Then, I mean, if you already have right to work in the UK, then you can work. If you right to work means that you have to have right to work, otherwise then you tier 2 work that you do here. All is there in our specialty training opportunities in the UK. You can get most of the answers from that post. I will show the post again here. This is the blog post that I'm keep coming into because it has how will I get a deanery sponsored visa, right to work in the UK. It explains all about the ways you can get exempt from RLMT. Then it takes all about, like, when the training usually opens, and also a huge list of specialties and all the other things. It's also discussed about ST3 training. We actually revamped this post. We update our post regularly in order to make sure that all the things that related to it are in the same page. It's 2:30 already. I think I will take just one question. I think the last question is there any job opportunity after completing plab 1? No, plab 1 doesn't get you anywhere. Plab 2 makes you eligible to apply for GMC registration. After GMC registration, you can apply to be a doctor in the UK. If you already have the competencies for training signed, then you can directly apply for a training job. If you don't, then it's advisable to start with a non-training job, get the competencies signed, make yourself eligible for training application, get your portfolio together, and apply for training and go on and go forth. It's been 1 hour of talking. I am sure that I could answer as much as possible the questions. If I have to go now because it's been 1 hour, but give me a second. If it has been helpful, please comment in the question below, the comment below a question, and we will definitely get back to it. Always, we have our website messenger in RoadToUK.com. You can just press on to the message bubble that is in the right side corner, and there will be a bot in the beginning that will ask you your name and some few questions so that I can answer your question better later on. Please state your name first. Don't straight away ask the question. The bot gets confused and we get our system gets like, what is this? We don't know. But yeah, ask the questions there. Comment in this this video or anywhere. We're always there to help you. Road2UK is paving your path to becoming a doctor in the UK, and we are glad that we are helping a lot of people. We are helping more than 150,000 doctors around the world, and it's amazing. Every month we can see in our analytics that more than 100,000 pages are being viewed. That means a lot of doctors is coming to our website and getting the information. We're keeping this for free to all of you, but obviously the arranging this doesn't cost me any money because I'm paying for the internet anyway. It's just cost me time. But I think my time is helping a lot of people, and that gives a peace of mind. All right, take care. Like us on Facebook, follow us on Instagram, and subscribe to our YouTube channel. Have a nice day.